Charlie, I am so glad you were able to meet me here today. That's great.
Well, it's have a wonderful place.
Well, thank
Thank you.
you.
Thank you very
Well,
much.
the opportunity we've had to be pals over the phone for the last year and whatever,
Yeah.
um, it's from my perspective, seeing I am the volunteer phone pal person and
Right.
I call you, and you very nicely pick up the phone when I call. It's been for me, Charlie, such a win-win situation, and I'm very serious about that
Well,
because I learn from you.
it's a wonderful. I've learned from you, and I appreciate your friendship. I really do.
Well, thank
It's
you.
wonderful.
And the whole concept of reaching out to people who are sort of stuck at home for a bit,
Yeah,
and
yeah.
particularly now with the pandemic going on, but just to have it so that I make the call, you know when it's going to happen, so you're ready, and we get to share things and learn from each other.
Right.
Yeah.
Exactly. My contacts with the outside world are rather limited, but not by choice. But yes, the SMA program has been just wonderful in every respect, every respect. And I don't know what I'd do without it. Like I say, I probably wouldn't be here. Loneliness is one of the most difficult things to challenge. And any contact that you can get, especially like through SMA, is more than a plus. More than a plus. And it's just a wonderful way to go. It really is.
I hear you,
Truly is.
Charlie, and with the pandemic, there are people who might have more relatives who would, typically be coming
Right.
in, but they've got children. They don't want their children to infect their grandparents, et cetera, et
You've got to
cetera.
stay home more.
That's right. The concept of loneliness is probably exploded.
Accelerated.
So-
Just the contact with people, even if it's only over the phone, is way better than nothing.
It is definitely something that is very cool about the program in the fact that we do have phone friends listening well, sensing that there's something that might not be quite right, so that our Meals on Wheels recipients who aren't able to get out on their own do have somebody there to say, okay, you need some help, and let's check into this. But you've been taking pretty good care of yourself.
Oh, thank you. I try. The meals are extremely well balanced, I think.
Oh, good. But it's somebody checking in on you who cares
Exactly.
that you're doing well.
Exactly.
Yeah.
It plus for the day. Exactly that.
There are new opportunities, and that's one thing that I think SMA is. They keep, SMA being the Southern Maine Agency on Aging, they keep their eyes and minds and ears open to what might be a new way to help the public, and the resources and whatnot. So
Right.
it's not a stagnant thing. It's a
No,
growing
certainly
thing,
isn't.
and it's really cool to be part of it.
Yeah. Not only would I recommend it, I would foster the idea. It would be a great way to stay connected with the world and meet some fine people along the way as well. And it's just wonderful in every respect.
Congratulations to everyone at Southern Maine Agency on Aging. I'm delighted to be with you at your Charting the Future event. I wish it could be in person. The Harvard Pilgrim Healthcare Foundation is hugely proud and honored to support you, but never more than now. Despite all of the roadblocks that come with a global pandemic, you haven't skipped a beat. You continue to help older adults with the highest quality programs and assistance, and especially with healthy food. And you're not just providing fresh food and meals to older adults, you're also delivering a wellness check and some much needed companionship, and doing it all while keeping everyone safe. The way you've mobilized resources and volunteers in your communities during the absolute worst of times to help others in need is nothing short of heroic. A million thanks to everyone at the Southern Maine Agency on Aging who are working tirelessly to make healthy food available and happily available to everyone in your community, and particularly to older adults. We salute you, and we are incredibly proud to support you.
Welcome to the annual Charting the Future event with Southern Maine Agency on Aging. Thanks for bearing with us through this unique digital format of our event. We're so thrilled. We're going to be welcoming over 350 people to today's event, which is a new record for us. So thank you to everybody who is joining us today. It's really, really exciting to be able to offer it in this digital format. Again, we wish it was seamless, but this is aging in a COVID world. So to kick off today's event, I am really pleased to introduce everyone to one of the many caregivers that we serve at Southern Maine Agency on Aging. Frank, who you are about to meet via video, has been taking his wife to the Sam L. Cohen Adult Day Center for years. And as many of you know, the Sam L. Cohen Adult Day Center is a state-of-the-art model where we serve adults with disabilities and adults with dementia. And in mid-March, when COVID hit Maine, we had to temporarily close the center to keep our staff members and caregivers safe. But today we're really pleased to be able to welcome back a smaller number of members. We're serving 10 to 14 people a day with heightened safety protocols, sanitation practices, and of course, social distancing, which again has allowed us to care for so many more people right now. So I am very pleased to introduce Frank to you now at our live event.
My wife was diagnosed almost 2 years ago now with Alzheimer's disease. She has trouble at night and trouble sleeping. And when we were home during that whole 19 weeks that the program was shut down, we both had trouble sleeping, because if Ruthie's having trouble sleeping, guess what? We all have trouble sleeping. And I'm sure people who have a loved one at home know what it's like. But when she goes to the Cohen Center, not that she doesn't have trouble sleeping, but it's a lot better. So there's so many pluses to being at the Cohen Center. One of the big things, and this is probably part of her disease, but because she was home and we explained to her it's because of the virus, she got really, really scared. She would not leave the house at all, which was good and bad, but she was afraid of everything and anything. The one thing that I noticed a lot, she started wandering. And I'm thinking, okay, I know the disease progresses and people lose skill and functioning, but she became more of a wanderer. Mm-hmm. And I think there's an anxiety issue to that. She's always been, I'm going to say, an emotional person, but never showed emotion so she could express it. Well, all of a sudden, she's tearing up. She's crying a lot. She's just feeling so empty. Things changed. And I'm thinking, I can see her, I'm going to use the word regress. She was losing and losing. And I'm thinking, this was not the way it was at the Cohen Center. I'm not saying it wasn't going to happen, but changes were a lot slower. Mm-hmm. So when they decided to open up and they had all these restrictions and all these protocols and all these new procedures, I said, I'll jump through any hoop I can get through to get her there. I really will. And what they always do, everything they've done opening up, making sure people were safe, taking care of folks, making sure that everybody around there is also safe. I'm thinking, wow, they took a lot of steps to do things correctly. And it's been, like I said, this is the second full week. I'm already seeing a positive change. I really am seeing she comes home, she's got things to talk about now. She's done things with the program. She's talked to people of the program. When we're having supper, it's not just me and my daughter talking. Ruth said, do you know what we did today? No, what did you do today, Ruthie? And she'll get into some of the activities or some of the functions she did. And it's like, oh, I love the Cohen Center. God love them. Because she has a life again. But whoa, was I happy to be one of the chosen people, really. Because I know how much it meant to Ruthie to go there. And she's almost back in her rhythm again already. It's only 2 weeks and she's already back doing the things she used to do. It's a big difference.
Welcome back. You are live behind the scenes at the Southern Maine Agency on Aging. We are, again, just thrilled to welcome you to our third annual Charting the Future event. First time we're hosting it digitally. Wow. I hope all of you enjoy hearing directly from Frank as much as I do. And Frank's story is one of dozens and dozens of caregivers who have been supported through our adult day center. So thank you again, Frank, for sharing. One thing that I really wanted to make sure all of you are aware of today at our event is that thanks to the generous support of the Board of Directors of Southern Maine Agency on Aging, as well as some of our closest friends and supporters, we are actually able to offer a really exciting match at today's event. So thanks to our supporters, gifts of $50 will be matched today, and gifts of $250 will actually be double matched. So your gift of $50 will become $100, and your gift of $250 will become $750. Again, this is our first time offering this really exciting match at this event, and it's really thanks to our board of directors as well as some of our closest friends and supporters of the agency. So thrilled to offer that today. And we know there's also a donate now button that's available both on our website, right, and also on the event page today. So that's where you can go for there. So for the next portion of the program, I'm just going to talk you through a little bit about the agency's response to COVID-19. And then we're going to get the chance to actually meet Judy Johanson live over Zoom. So we're really excited about that. But let me just go back to Frank's video for those of you who had the chance to meet Frank just now online. From March through July of this year, all of our Cohen Center caregivers and members actually received weekly check-in calls from an agency social worker. We were able to drop off packets for members and their loved ones, including tips, activities, articles, other resources to support families during this really unique time. We were able to send photo slideshows, musical entertainment over video. And while we couldn't be together in person, the spirit of the day center was really kept alive through the dedication of our staff team and the caregivers and the members and innovative ways that we were able to stay connected to people. I know that there are many volunteers on the line today, and one really exciting statistic that we have just been continuing to demonstrate out in the community is that 330 people in our community stepped forward to volunteer with Southern Maine Agency on Aging when COVID hit. 330. And 46 of those volunteers actually took part in a volunteer resource team. So if there is an emergency response that comes up wherever, whenever needed, these 46 volunteers have stepped up to say, yes, I can do that. So this response really, again, highlights that we here in Maine are problem solvers. When we see an opportunity or a challenge, we just figure out how to seize it. So thank you to those new volunteers, and thank you to those volunteers who have continued to work with us during this pandemic. I also wanted to share that while our volunteers are providing those critical services, they're also getting a lot out of this experience themselves. I was recently talking with a volunteer who said, I feel like I've found another place of connection with Southern Maine Agency on Aging through COVID. I see people regularly via Zoom when the technology works, and I feel like I'm making a difference even in these hard times. Another extremely important need for older adults that the agency has been meeting during this time prior to the pandemic and also during the pandemic is nutrition. So today we are serving close to 5,000 meals per week to clients in York and Cumberland counties. This is actually close to double the amount of meals we were providing prior to the pandemic. And this is, again, really in thanks to the federal government, local foundations and businesses and individuals like you who have said it's important to make sure that vulnerable members of our community are fed and have a nutritious meal when they need it most. So thank you for being part of that. Another key part of our response to COVID-19 has been ensuring that we are still offering wellness initiatives, helping people stay active, manage stress, and maintain social connections. We began virtual programming via Zoom in early April, and we had a set weekly schedule of classes, everything from guided relaxation, gentle exercise, Tai Chi, welcome to Zoom, coffee hour gatherings. We also had some special events like the Engaging Project, Freedom from Fractures, and using creativity to find balance during challenging times. So since April, we have offered 40 virtual programs to members in both Cumberland and York counties. And I think, if anything, this pandemic has really highlighted how all of us, no matter our age, really need to connect with one another locally, nationally, globally. You're seeing that. And that's why we shifted to all phone and web-based meetings and consultations. So our resource specialists are connecting one-on-one with clients today, virtually or over the phone, to conduct benefit screenings, provide assistance with housing or other applications, and constantly connect people in our community with the resources that they need. We're continuing to offer Medicare and insurance counseling assistance, and we built the online capacity to offer our Welcome to Medicare seminar online. And thanks to our incredible team of volunteers, again, some of those Medicare volunteers are on the line today, we're going to be able to offer hundreds of phone and Zoom appointments for clients coming into this Medicare open enrollment period. So thank you. And again, another incredible response has been our Phone Pal program. We have over 90 Phone Pal clients today who are connected with a volunteer who's ready and willing to give them a call 2 to 3 times a week and make a connection. There's an incredible video about our Phone Pal program, which we will highlight after the event, some of our follow-up materials. But again, it's just incredible to see the way that the community has stepped up. And finally, COVID has again made us realize how easy it is to be lonely, how easy it is to be isolated without contact. A recent Health Affairs article referenced this time in our country as the double pandemic, COVID-19 and the social isolation pandemic. It's present in all parts of our lives: education, recreation, transportation, entertainment, employment. There's a social part to everything in our lives. And without that, and without supports from organizations like Southern Maine Agency on Aging, we are putting our older adults and caregivers at risk. And so that's why I'm so excited for today's program. I'm so excited that Dr. Nirav Shah has some remarks that he's prepared to share with us. And I'm really excited to welcome Judy Johanson. So Judy joins us today as the Clinical Research Ambassador at the Massachusetts Alzheimer's Disease Research Center. Judy is mother to her 2 grown married children and Nana to 4 adored grandchildren who are in the background of her screen today. And she's also wife and soulmate to her late husband, Steve, who carried the chains of younger onset Alzheimer's for nearly 7 years. With guidance from the Alzheimer's Association and Steve's remarkable neurologist, Judy and Steve became advocates and used their voices to bring awareness to the challenges surrounding a dementia diagnosis. So Judy, thank you so much for joining us today and welcome.
Thanks, Megan. I'm really happy to be here. We're working on getting a video on there. But in the meantime, I just would like to say that Dr. Doreen Rentz, who I work with at the Massachusetts Alzheimer's Disease Research Center, who could not be here today, asked me to give her best and convey her admiration for the important work you're doing at Southern Maine Agency on Aging. Maine holds a very dear place in my heart, as some of our family's most treasured memories have been made on its southern shores for the past 60 years. And the reason I'm here today, as Megan said, is because my darling husband, Steve, to give you a reference, this is that handsome gentleman, placed his trust in me and asked me to be the steward of his care when he was diagnosed with Alzheimer's. Prepared or not for these uncharted waters, I accepted this role. How could I not? We had hit the lottery of love with each other, and we would have gone anywhere with each other together. At age 58 and a half, Steve received a poor performance review at work, and he was devastated, as he had prided himself in the integrity and quality of his work. Having been a construction project manager in the Special Projects Division at Northeastern University meant that he was dealing with complex schedule coordination, enormous fiscal planning, personnel issues, and more. At that same time, we were watching his mother in her 4th year post-Alzheimer's diagnosis, and we had a little bit of an idea of what it looked like and it literally became Steve's worst fear for himself. I had tried to give little thought of things like him repeatedly forgetting our bank password or losing his keys at work, and I'd go in and show up and they'd be in his pocket. But the evidence was there and it was mounting. I just didn't want to acknowledge it. Neither of us did. Upon receiving this poor performance review, he said immediately, "I think I might have Alzheimer's." We visited his general practitioner immediately and then pushed through 5 months of testing, which led to the heartbreaking diagnosis of probable Alzheimer's 1 month shy of his 59th birthday. The first thing he said upon his diagnosis was, "I'm so sad that I won't get to watch our grandchildren grow up and play baseball." But then Steve being Steve, he quickly shifted gears and said, "Well, we have two choices. We can be happy or we can be sad. And the fact that we have love will cause us to smile each day." We were overwhelmed and we knew we needed to seek counsel immediately to chart our new future. We talked to his neurologist, the Alzheimer's Association, a social worker, and friends and family. I spent hours and hours online searching for information. We had a care consultation at the Alzheimer's Association. We met with an elder law attorney and decided to live as well as we could, knowing that our time together was limited. We felt that being diagnosed early was a gift. Steve felt strongly that he wanted to be involved in planning for the future, and this afforded us that opportunity. It was not always easy to discuss our future, as we couldn't imagine a future devoid of one another, and we often would abandon the conversation that would inevitably become wrought with emotion. Author Cheryl Strayed said, "You don't have the right to the card you believe you should have been dealt. You have an obligation to play the hell out of the ones you're holding." That's how Steve and I decided to approach this journey. We joined a support group. We got involved in programs that would keep us socially engaged with others on a similar journey. We advocated both on state and federal levels for more research funding, earlier diagnosis, better care for those living with dementia, and more robust education and support for caregivers. We traveled to leadership summits to share our story. We rallied our community to raise awareness about living with Alzheimer's. And one day we even turned Wells Beach, Maine purple. We invited people to wear purple that day and got Congdons to make purple donuts. We had film crews in our home as part of a documentary about citizen science. We attended memory cafes and more. In the later stages of the disease, my children and I worked hard to continue creating successful strategies for Steve as he navigated this more challenging part of the journey. We feel we did a pretty good job, and I got the blessing of living out our vows, and we both know that we stood together, as we said many years ago, in sickness and in health. Steve wanted to be involved in research as much as possible, and his final gift to science when he passed away in April 2018 was the donation of his brain. I like to say he left his brain to Mass General and his heart to me, and now I get to keep them together by the work I'm doing as a research ambassador for the Massachusetts Alzheimer's Disease Research Center. I also get to offer a caregiver's perspective to the Dementia Care Collaborative. This offers me a chance to keep on with the work that we started together and keep playing the hell out of that hand. During this pandemic, our division head of our memory disorder outpatient unit, Dr. Teresa Gomez Isla, determined that she wanted every one of the 1,200 patients to be contacted by phone to let people know that in their isolation, they were not forgotten and assure them that they were not alone. I spent 2 months, along with other colleagues, on the phone with patients and caregivers. This was yet another gift in my life as people welcomed me into their stories and were happy for the conversation. They informed me of how they were surviving during this time of COVID. People were not able to visit their loved ones in facilities. They were not able to send their loved ones to vital day programs and not able to have caregivers and family come into the homes. I was astounded at the resiliency and persistence in the face of these caregivers now having to provide 24/7 care without any relief. What was amazing to me was at the end of every single conversation, a caregiver would say to me, "How are you?" And I found that amazing that in their time of exhaustion, they still had that in them. We wanted to offer any resources we could via our social workers. We compiled services that had gone virtual. As Megan mentioned, one of the upsides is now that education programs and support groups have gone virtual. And in some ways, resources have become more possible for caregivers to attend. Just make sure you note what time zone it's happening in. Museums, theaters, memory cafes, and more are reaching out as far as they can through the magic of virtual conferencing to extend into the homes and facilities of those who need this help. I had one caregiver say to me that the isolation didn't feel that different than usual, as they were already housebound with their loved one who had Alzheimer's. This really struck me as to how much more needs to be done. While a cure for Alzheimer's and other related dementias is paramount, charting the future for the over 5 million living with this disease and their caregivers is a quest we must continue to define and refine. In closing, I would just like to say to all the caregivers out there, while it might seem at times that you are alone, you do not have to do this on your own. I look back and some of my most successful days as a caregiver were the ones when I said out loud, I need help.
Judy, thank you so much for sharing your story with us today. It was really, really powerful to hear directly from you. And I think that's one of the hard parts about this digital event is that we can't be together in the room to just experience it and the magic of being together in the room. I have a couple of questions that I've received from caregivers, if it's okay to ask them of you now.
Sure.
I think you started to allude to this at the end, that it's about, the people right now who are living with dementia and how we can better support them through our systems and our environments. And I'm curious, in what ways have you seen our healthcare system or our social services system, or again, the people and programs that you interacted with when you were with Steve, how are they ready to serve people with dementia? And what are the challenges that we still have in making sure that our environment is prepared?
Well, I think we can see both virtually how programs are prepared to go virtually and understand that they need to get it to people within their homes. But the other thing is virtually presents technical challenges. And for the most savvy, you can imagine how hard it is. Imagine for people who are elderly and in their homes and are not so in tune with technology. If in my dream world, I would love to see people sent a device that would be pre-programmed for them to be able to tap into resources with one tap. I would like to see videos online that instruct people how to get involved in a Zoom meeting. I have said about 1 million times during this pandemic that if you want to know what it feels like to be disconnected with Alzheimer's, we're all experiencing that right now. So in a way, it gives us this opportunity to lean in a little bit further to understanding the challenges that people are facing when they live with Alzheimer's and other related dementias.
Absolutely. It's opening up, I think, the whole world to the ways that we are set up to succeed or not at all. I'm glad also to hear you mention technology, because that's definitely something we've been witnessing, this digital divide between those who are able to log in via Zoom or come to a virtual event like this one, and those who either don't have access or don't have the education or training to be able to do it. And it is confusing. you said at the end, you know, I want caregivers to know that you are not alone. Um, is there any other message of hope or encouragement, or even just some general tips that you could provide to those caregivers who are on the call today?
Sure. And, you know, I like to say, I make it all sound like I did all these things. This is looking back. Hindsight is 2020, right? But what I would like to say to people again is sometimes we don't like to admit that we're vulnerable. This is a very, very vulnerable disease. And for us being younger, with friends who are still working, who are still traveling, still having intellectual conversations that Steve used to conduct, and, you know, we were vulnerable. But I found that when we, rather than trying to hide that, admitting that we were going through this and that things weren't great, you know, that people again leaned in a little bit further to offer us support that we needed. And I remember the first support group I went to, and I thought, gosh, do I really need to be at this support group to hear other people what they're going through? And do they need to hear what I'm going through? But as I sat there and I listened, I realized that while everybody's journeys are different because of the demographics of their life, it's still very similar. And when you hear from someone who has more challenges than you, and you realize that they're doing it, it's inspirational to you to keep going. And the bond and the foundation that helps you build upon to go through this journey is, my friends that I have made through support groups through the years, we still talk once or twice a week. We had a thing that we would say, send me a virtual scream if you were in a moment that you felt like you were going to scream, but knew that wouldn't really play out very successfully with your loved one. Text it to me, scream. It's so important not to do this alone. And it's so instinctive to want to do it alone.
Mm-hmm. Wow. Judy, thank you so much. Just really, really inspiring to hear your story, and thank you for sharing the photo of Steve as well, and just for the advocacy and education that you continue to do. It's really inspiring, I think, to all of us here. So thank you. And I look forward to when we can be together in person. Yeah. So thank you.
Sometimes when you deliver a meal or a new client, one of the first things they will say was, oh my God, I need it. And it's sad to hear people say, I need the meal, I need the food. It's amazing how many people today, that, especially the elderly, that need this program, not only to socialize, to see somebody, to actually say hi to them, but for the food. But it's also low in sodium. It's healthy meals. Not like you're just going to cook at home. It's healthy foods. But she was saying, I think my husband has felt a lot better since he's been on these meals. And it was like, this is what you want to hear, that it's doing what it's intended to do. We've always had emergency meals, always, where, especially in the winter, if we got a snowstorm, we can't deliver, they have extra meals. But a few extra times they have sent extra meals for the people to make sure with COVID, if anything happened, to make sure they do have food in the freezer. Some of the others will complain to me about family not checking enough, not doing enough. And it's surprising how many are just alone, that just them, and they have nobody. Or if they have family, they say they don't phone. I was delivering to a lady in Waterboro who I know never ever leaves her home. She's early 90s, a sweetheart, and I know she's always home. So I got there, and I know she has a hard time getting out of her chair, so I kind of got to wait for her to answer the door. So I rang the doorbell, and she didn't answer. Well, the third time we're ringing the doorbell, now I know something's wrong. Number one, of course, her age. She can't walk very good, but I know she's at home. So I finally find a window with a curtain open, and I become a peeping Tom and trying to see inside of the window, and I see her laying on the floor and scared me to death. So instantly I called 911, and I got a hold of the Waterboro Fire Department, which was right across the street. So I watched them get in the ambulance and fire truck, and they came over. My niece is one of the EMTs and a fireman, and she looked through the window and she could tell that the woman was breathing. And she said, "Bob, she's alive." So they tried all the doors. Of course, everything's locked up tight. So finally, they're just going to break the door down to get in. And one of the firemen happened to try a window, and the window opened right up. So he went in and came out. She had broken a shoulder. And of course, she couldn't get off the floor. She couldn't move. But she was so sweet. They finally got her ready, and they brought her out to the ambulance. She held my hand and said hello with a smile on her face. And I'm like, what a lady. Everybody I know that does it feels the same way. I'll be back at the shop. I call it the shop, and get my coolers and stuff in. And sometimes other people will come in with their coolers, and they're just like me, telling Deb of who didn't feel good or who wasn't home. And they really watch their clients too, as to know them as people, not just somebody you're delivering food to, as people. And they know their habits, and able to get help when needed. And it's just a good feeling to know that little bit that we can be there if somebody needs the help. I love every day of it. I love every minute of it. And if anybody's interested, do it, because it's awesome. The people that you meet, and sometimes it's fun and sometimes it's sad, but it's all pretty awesome.
Welcome back to the event after that really powerful story. I love hearing directly from our volunteers who do this incredible work day in and day out. I wanted to take a moment to thank our very generous sponsors who are behind the magic of this digital event. So we want to thank our innovator sponsors, Cognivue, Ocean View, Harvard Pilgrim Healthcare, and Hannaford. Thank you so much for your support to our innovator sponsors, to our explorer sponsors, Humana, Clark Insurance, and Bolus Company. Thank you so much for your support of this event. And to our stewards and hosts, Kennebunk Savings Bank, Martins Point Healthcare, Trualta, Barry Dunn, and the University of New England. It's with your support that we can make this event happen. So thank you to our sponsors. I know many of you have already gone ahead and clicked on the Donate Now button, but if you have not already, this is a good time to remind you that today is our day to raise the challenge match. Again, thanks to our board of directors and our incredible close friends and supporters. Gifts of $50 or more will be matched today with $50, and gifts of $250 or more will be matched with $500. So your gift of $50 will become $100, and your gift of $250 will become $750. So this is a really exciting opportunity, and thank you for joining us. I think, again, so excited to introduce Dr. Nirav Shah next, but if COVID has taught us anything, it's really that we all need to be in contact with people, even if it's over the phone, behind a face mask, 6 feet apart, or via an online event. That's why Southern Maine Agency on Aging is here to support older adults. and support them and us when we need it most. So thank you. With the gift to the agency today, you're making an investment in our community and our shared vision. So thank you again for joining us. It's my great pleasure to introduce Dr. Nirav Shah, who, as you know, is a man who's in high demand these days as the director of the Maine CDC. He has prepared an incredible 20-minute presentation for us today. And so I'm going to go ahead and hand it over to Dr. Shah for a really exciting highlight of our event here today. Thank you, Dr. Shah.
Well, hello, everyone. My name is Nirav Shah. I'm the director of Maine Center for Disease Control and Prevention, and I am delighted to be able to join you today, albeit virtually. These are challenging times, these are different times, but I'm glad that technology of this sort is allowing us to connect, even though they may be far away. I'm really delighted to speak with everyone at this year's Southern Maine Agency on Aging annual meeting to talk about everything related to COVID-19, particularly the impact that it might be having on older Mainers right now. Before I dive in, I'd like to take a moment to thank a couple folks. First, I'd like to thank Megan Walton, the CEO of the Southern Maine Agency on Aging, for the very kind and generous invitation to join everyone today, as well as for Megan's assistance and dedication in organizing today's event. I am again so delighted to be able to join everyone, even though it's in this new type of format. I'd also like to take a second to thank Molly Stokes, who has worked really hard with us on the logistics to make this pre-recorded event actually happen. Molly and Megan, I really do thank both of you, not just for the invitation, but for your flexibility in working with us to make this opportunity happen. I'd also like to thank everyone who is registered and who is tuning in today for your time. There is so much going on right now with respect to COVID that it's really critical that we all take some time to tune in and keep on top of what's going on. So for everyone who's joined virtually today, thank you for taking some time to listen to where things are and perhaps a few thoughts on where things might go. I'd like to do a couple of things today. The first is just talk generally about where things stand with respect to COVID-19 in the state of Maine. Second, talk a little bit about how that current situation of COVID-19 is having a definable, measurable, solid impact on seniors across Maine. And then transition a little bit to talking a little bit about the response that we at the state of Maine have put into place in an effort to try to keep as much of a lid on COVID as possible and how we will continue to do that. And then finally, talk about what the future could potentially hold, both from a risk perspective as well as from an opportunities perspective, and take an opportunity with everyone to look onto the horizon and see where things might be going. So let's start with where things stand right now across the state. And the bottom line is that the state of Maine is in an interesting position. We've got now just over 4,600 cases of COVID-19, and by the time you're watching this, that number is likely to be even higher. Those cases have increased in recent weeks owing to certain events that have taken place, both starting in and around the Millinocket area and then spreading down to York County. Those events have been illustrative of just how quickly and opportunistically COVID-19 can spread. And they've certainly been on all of our minds at the Maine CDC, and I'm sure on the minds of everyone who's joined us today. At the same time, we've been contending with outbreaks of that nature, however, we've also been doing work to expand things like the availability of testing as well as contact tracing. Overall, the positivity rate across the state of Maine stands at just around 0.5 percentage point. The positivity rate is the percentage of tests that come back as positive as a fraction of all of the tests that are being done in Maine. The higher that rate is, the more likelihood there is that there are certain large pockets of disease we are not able to account for in the state. The lower that number is, the greater security that we have in saying, we're not sure everything that's going out there, but because of our robust testing, we've got a good sense that we're capturing it. So on one hand, even though we've seen notable, significant outbreaks like that associated with the wedding in and around Millinocket and subsequent outbreaks in York County connected with that, we also see that our testing architecture has expanded significantly, which allows us to get a handle on these situations, ideally before they flare out of control. Let me be clear. Right now, where things stand in Maine is both a mixture of encouraging factors as well as concerning factors. We've got encouraging factors in the form of a robust contact tracing system as well as robust testing. But we also have concerning factors. We've got notable outbreaks like the one I mentioned, as well as a drumbeat of reports of large groups that are continuing to gather, even in the face of best available public health evidence. What this means for seniors in particular is a few things. The first is that there are challenges that are unique to seniors in the face of COVID-19 that are related to the healthcare system and those that are caring for them. So I want to spend some time talking about that issue in particular. For months now, folks like me, folks in the public health community, have advised everyone across the state, seniors included, to do things like staying inside to reduce the likelihood of getting COVID-19. And for months now, that advice has been designed to try to keep individuals safe, including everyone who might be watching today. But now here we are 6 months into the pandemic, 7 months, 8 months. And what we've seen is that in many instances, that advice has been taken to heart. That's a good thing. But we can't let that advice to stay inside supersede other requirements that we know are necessary to stay healthy. Like, for example, checking in with your primary healthcare professional. So one of my key messages to everybody today is to make sure that notwithstanding the COVID-19 pandemic, you are checking in and scheduling regular, important, preventive healthcare visits with your doctor, with members of your healthcare team, so that you can be staying safe. As we think about caring for older Mainers, what we know and what we have worked with healthcare professionals on is the need for them to approach this situation as a participatory endeavor, working in concert with older Mainers. The bottom line here is that this is a collaborative approach. It's not a situation of healthcare providers paternalistically taking care of older folks. Rather, it's about older Mainers actively participating in an allied system with their healthcare provider. So the message that we have for those of you who have joined us today is straightforward. During this time of COVID, despite this time of COVID, despite your inclination to follow longstanding advice to stay inside and isolate, it's more important than ever to stay on top of your chronic healthcare conditions. Not just chronic healthcare conditions, but basic well care. You may be worried about going to your doctor. You may be worried about exposing yourself to COVID-19 from things like a waiting room. You may be worried that healthcare providers in your doctor's office may be inadvertently exposing you to COVID-19. My message today is that healthcare providers in Maine, across Maine, are very well skilled and well practiced in ways that they can keep their doors open and simultaneously and safely connect with you as patients. COVID-19 is new for all of us, But for healthcare providers, the basic universal precautions that they have in place to use PPE to make sure they are limiting their likelihood of transmitting COVID-19, the fact is that's everyday common practice for them. So while you may be very fastidious about not coming closer than 6 feet with anyone else in your life, when it comes to your doctor or healthcare provider, it is okay to be within 6 feet of them. Let's not let COVID-19 be a reason that you don't go and check in with your healthcare provider. The fact is, we are at a place in the COVID-19 pandemic where there is a risk of letting things like preventive healthcare go by the wayside and remain unaddressed for 6 or more months. In the same way that we are trying to contain the virus, we are and can simultaneously contain the unintended and sometimes direct adverse health consequences that can happen if we don't care for chronic healthcare conditions. The bottom line here is that our laser focus on COVID should not distract us from taking care of chronic healthcare conditions like diabetes, hypertension, and heart disease. So my key message for you today is that if you've been putting off preventive healthcare or caring for your chronic conditions because of COVID, as soon as you're done listening today, please call your doctor's office. They are standing by to make sure that you get the healthcare you need. If it's been more than an X number of days before you've gotten your hemoglobin A1C checked, today is the day to call your doctor's office and get up to speed on all your numbers. The fact is, we can do both. We can simultaneously contend with COVID-19 and also make sure that older Mainers get the healthcare they need. We don't need to choose. It is not an either or. It's not you either stay in and avoid COVID or you go to the doctor. The fact is, we can do both. You can reduce your likelihood of being exposed to COVID-19 and go to your doctor's office. So please, as soon as we're wrapped up today, if you've been putting off a visit to your primary care provider, today is the day that I'd like you to schedule that appointment. The other really important thing I want to talk about is making sure you get your flu shot. We are at the time of the year where doctors' offices, pharmacies, health clinics across the state are starting to offer the flu vaccine. When you're making that call to your doctor's office, make sure you ask them whether they've got the flu vaccine and whether you can get it. Now, there are different kinds of flu vaccines. Some of them are better suited for older Mainers than others. Your physician's office, your healthcare provider's office will know which vaccine is best for you. But what I encourage all of you to do is make sure you are having that conversation with them. And now is the best time to have that conversation. And while you're at it, make sure you're asking your healthcare provider not just about the flu vaccine, but other adult vaccinations that you could get caught up to speed on. You know, it's interesting. We tend to think of vaccines and the vaccine schedule as something that's for younger kids. But the fact is that even for older individuals, it's just as important to stay on track with your vaccine. So things like vaccines for pneumonia, vaccines for shingles, vaccines for the flu are more important this season than I think in any other time they have been in recent years. As you're calling your healthcare provider, please make sure you ask about getting caught up and up to date on all your adult vaccines and immunizations. So let's take a moment now to shift and talk a little bit about the response to COVID-19 overall at the state level. We have, over the past several months, put into place a very aggressive system, working with stakeholders across the state to do things that simultaneously keep individuals safe while allowing social and economic activity to start to resume in stages. And our goal is to continue down that pathway as much as we can. Initially, of course, we closed things down. The goal was to get a tight grip on COVID-19. But having achieved that grip, having put a lid on COVID-19, we then started resuming economic and social activity in stages. And that's where we are right now, moving toward and moving along a reopening pathway in stages. However, as more businesses open up, as more social activity resumes, the possibility, the likelihood that there will be upticks, if not flare-ups of COVID-19 cannot be ignored. And so for that reason, even as you yourself may be resuming economic and social activity, tiptoeing back into the water, it's more important than ever to do three things. The first is making sure you are wearing a face covering anytime you're going outside or anytime you are interacting with folks, even in your own home, who may be outside of your so-called bubble, individuals who are not direct family members. Wearing a face covering for everybody is one of the surest ways to reduce the likelihood of introducing COVID-19 into your social circle, into that bubble. The second thing is staying as far apart as possible. Now, let me be clear. I will be the first to acknowledge that in a time of a pandemic, being able to interact physically, to hug your family members, to be close with them physically is really important. Unfortunately, doing so comes with the unintended consequence, side effect of introducing the possibility of COVID-19 spread. Can we have both? Perhaps. If it's a close family member who has been in quarantine for 14 days, then physical interaction is a lower risk. But if it's someone who has come to Maine from a higher risk part of the country, close physical contact, by which I mean more than 15 minutes within a 6-foot radius, introduces risks of transmitting COVID-19. In those settings, as much as we all want to hug our family members, keeping that physical distance as well as wearing a mask reduces the likelihood of COVID-19 transmission. I'm going to be straight with everybody. It's not pleasant. It's awkward. It's not what we want, especially since so many of us have been inside and away from our loved ones for so long. But given what we know about COVID-19, the risk of transmission is there. We've also seen, not just in Maine, but across the country, COVID-19 has had a disproportionate impact on older folks. Right now in Maine, about 1/4 of all of the cases that we've had have been in individuals who are above the age of 60. 1/4 of the cases have been in those above the age of 60. So we're in a situation right now where we can't let up on the very things that have gotten to our favorable position right now. As I look into the future with COVID-19, one of the things that is important to note is that we don't know what the future is going to hold. And that raises risks. It raises uncertainty. And uncertainty is unsettling. But one of the things that we're all hopeful about is the potential for a quick introduction of a vaccine. Now, there's been a lot in the media about when a vaccine might be introduced and what regulatory approvals it might go through. I'm not going to get into any of those weeds right now. What I want to say is the following. Ever since April, Maine CDC has been working on the logistics as well as the administration plan so that when a vaccine becomes available, and when it has been fully vetted by health authorities across the country, we will stand poised to be able to deliver that vaccine quickly, safely, and equitably. There are a lot of questions that are still under discussion. Who will be first in line for a vaccine? Who will be second in line? And how we distribute the vaccine. In a time of COVID, the last thing we want is a lot of people jammed into a small space just to try to get vaccinated. That in and of itself could start transmitting the vaccine. So we are and have been planning now for about 4.5, almost 5 months for how we can quickly, efficiently, safely, and equitably distribute a vaccine to everybody across the state. Given the disproportionate impact of COVID-19 on older Mainers, we are placing older individuals higher on the prioritization list, as we are with direct frontline healthcare workers. We want to make sure that we can start vaccinating healthcare workers and use them as a force multiplier to start vaccinating older Mainers. The process is going to be a challenge. It is a massive logistical undertaking, and one that will take all of us rowing in the same direction to get right. I'm asking both for your cooperation as well as your patience as we start rolling out those plans. Whenever a vaccine becomes available, the demand on day one will most certainly exceed what we have in terms of a supply. But as vaccine becomes more and more available, we at the Maine CDC pledge to be able to work with organizations across the state, across the country, to roll it out to each and every one of you as soon as we can, after we ourselves have made sure that the vaccine meets and exceeds the necessary safety thresholds that we have in place. There will be many more discussions to be had around this, and I look forward to joining you again at some point to give you an update on where things stand around vaccines. So with that, I would again like to thank everybody for taking some time today for joining. I very much appreciate your this opportunity to check in with you and share with you where things stand across the state of Maine with COVID-19. Finally, again, a sincere thanks to the Southern Maine Agency on Aging for the invitation to join all of you today. I'm very honored to be able to speak with you, albeit from a distance. Hopefully, at some point in the very near future, it will all be safe for us to be in a room together. And at that time, I can't wait to join you again.
That concludes Charting the Future 2020 Aging in a COVID World. Thank you so much, everybody, for attending our 3rd annual event. As I've mentioned, we have a Donate Now button on our website. And thanks to the support from our sponsors, the board of directors, as well as some of our closest friends, we're able to offer a match today. So thank you to those of you who have already donated. Thank you so much for joining us for meeting with some of these extraordinary speakers, both Judy and Dr. Shah. It's been wonderful to have you here for this event. We look forward to sharing a lot of this content on our website. So if you'd like to watch it again or share it with somebody you know, there's the opportunity to do that. But thank you for joining us behind the scenes here today at Southern Maine Agency on Aging, and thank you for your support for our community and for older adults. We hope that you have a wonderful afternoon. Thank you.